My name is Kate Sullivan. I'm at Children's Hospital of Philadelphia.
And hi, my name is Mary Beth Fasano, and I am at the University of Iowa in Iowa City. I'm an allergy immunology specialist who works with children and adults, and I had the pleasure of first meeting Dr. Sullivan when we were doing our fellowship training together. Not too many years ago, I guess. And so, Kate, I've always been wanting to ask you, why did you decide to go into allergy immunology as a subspecialty?
I really liked the idea of being able to double board in rheumatology and allergy immunology. Back then it wasn't as facile as it is now, but it was, to me, a very sensible relationship, and my research is on lupus. So for me it was a great mix. And then I have a PhD, and I loved the mechanism. So I really liked being able to think about diseases from the gene defect through the biochemistry all the way to the phenotype of the patient. If you think about it, there aren't so many specialties where you can do that. So it was a great fit for me, and I continue to do immunology, and I love walking in the door every day and going to my job. So it's been a very good experience, and then of course during training I got to meet you, and so it's been wonderful.
There you go.
So what led you to go into allergy immunology?
Oh, gosh. You know, I was just very passionate about immunology and learning about how the immune system played a role in host defense against infection, and also how the immune system played a role in allergic reactions to pollens and to foods and things like that. The other thing that I really liked about allergy immunology, which I'm not sure if Kate did or not, is that I get to see people of all ages. So I do a lot of clinical work. I don't have a laboratory or research-based career. So I see lots of patients, and I love going from Monday mornings where I'm in the pediatric clinic seeing the 6-month-old to Wednesday morning when I'm over in the adult clinic, and I might even see a 66-year-old. And so I like doing what I call womb to tomb medicine, where I can see patients of all ages who have allergic and immunologic disorders.
Wow.
Kind of neat.
Yeah. It is. You know, I only do pediatrics, but I really admire that about the specialty and about you as well. I think it has to be really exciting and unpredictable every day.
Yeah. So Kate, I guess maybe something, if you could maybe pick out some of the most fun things about going into allergy immunology. So for somebody who might be interested in thinking about doing that after they finish their pediatric residency or their medicine residency, what's the one thing that you would piece of advice you'd give them?
I don't know if it's the one thing, but one thing we haven't talked about is that it's a really happy specialty. People tend to do very well, and I like that. For me, that's a great feature of this specialty.
Yeah, I think, I would agree with that as well. Some of the things I think that we both do is we will see patients who might have very common disorders, maybe some allergies or some more common rheumatologic disorders, and we can make them feel better. Mm-hmm. And that's really very, very rewarding. Or sometimes we both see people who have very rare disorders, which can be quite severe, but yet we still have ways where we can help them and educate them and their families about their condition, and it really can be very, very rewarding. Allergy immunology, I think, is also, it's a small subspecialty, so going back to ongoing interactions and collaborations and fun that we have. So Kate and I are both fellows of the American Academy of Allergy, Asthma, and Immunology, and it's been a wonderful sort of professional home, I think, for the two of us to have. And we love running into each other at our national meetings and having a chance to catch up and find out about some of the cool stuff that we're each doing at our individual institutions.
Absolutely.